something very interesting. You want to hear it? Actually, it's more than interesting. It's stunning. Stunning. From John Goodman, Dr. John Goodman, National Center for Policy Analysis. Listen to this. We now know how many people have the problem most often cited as the reason for last year's health overhaul legislation. Answer, 8,000. 8,000. Stick with me. No, that's not a misprint. Out of 310 million Americans, only 8,000 people have the problem given as the principal reason for spending almost $1 trillion, creating more than 150 regulatory agencies, and causing perhaps 150 million or more people to forcibly change the coverage they now have. Stick with me. This is stunning. Alert readers will remember the White House summer of 2009 invitation to all Americans to send in their horror stories describing health insurance industry abuses. Although the complaints were many, the vast majority were about pre-existing condition limits. Then on the eve of the Obamacare vote, every member of Congress who appeared on TV to defend the legislation was able to cite by name an individual or family in his or her state or in his or her congressional district with a heart-wrenching story. Gone was any interest in universal coverage or insuring the uninsured or helping poor people get health care. The case for change was focused exclusively on protecting the middle class from miserly insurance companies. Although the most important parts of Obamacare, the individual mandates, subsidies, employer fines, etc., don't kick in until 2014, the legislation made interim provision for those with pre-existing condition problems. 8,000 people out of 310 million had pre-existing condition problems. 8,000. A new kind of risk pool is open to anyone who is denied insurance in the private sector, and it's available for the same premiums healthy people pay. 23 states are operating their own risk pools, and 27 are relying on a federal plan. It's been like giving a party in which nobody comes. The Medicare program chief actuary predicted last spring that 375,000 people would sign up for the new risk pool insurance in 2010. By the end of November, 8,000 had done so. 8,000. That is 8,000 who couldn't get coverage because of pre-existing conditions. As Amy Goldstein reports in the Washington Compost, this includes 75 people in Virginia, 80 people in New Hampshire, 97 people in Maryland, and a whopping 700 in North Carolina. While a lot of people are surprised by these numbers, writes Dr. Goodman, I am not. Here's why. Don't you think it's a bit odd for the White House to send out an appeal to victims so that they can identify themselves? That's not normally how the political system works. The more usual scenario is victims unite and form interest groups. They lobby Congress, write letters, testify, etc. Eventually the pressure becomes so great that Congress legislates. When have you ever heard of that entire process in reverse? When has Congress ever before decided it wants to do something and then conducted a nationwide search to find people who'd benefit? 8,000. Tell your friends and neighbors and anybody else who will listen. 8,000 people with pre-existing conditions, couldn't get coverage out of 310 million. The reasons for the reversal is that this whole problem has been completely hyped and exaggerated from the get-go. In this country, we have made it increasingly easy for people to get health insurance after they get sick. Going to work for an employer with generous health benefits, for example, is the most direct way. Of course, that system will miss people who are too sick to work, and that may explain why the few who are signing up appear to have very high medical expenses, even though they have less than 1/40th of the expected enrollment. The plans are already running out of the money. I keep saying this has never been about health care. It's about liberty versus tyranny. It is about the citizen versus government, the individual versus the politician. They want control over your body. They want you to have to come to them for your medicine, for your procedures, for whatever technologies are available. They're building a massive bureaucracy with all kinds of tributaries. That is, offices and units and divisions and czars to make all these decisions for you and then impose them on you. That's why they laugh at the Constitution. None of this is constitutional. None of it. That's why they pretend that the Constitution is too complicated or too old, incomprehensible. That's why they revere big government and big bureaucracies. That's why they revere thousands of pages of legislation and detest the Constitution. For if the Constitution were actually effectuated, the liberals would fail. None of this would be going on. I think I've said it 25 times already. I'm going to say it one more time. John Goodman of the National Center for Policy Analysis makes the point that out of 310 million Americans, 8,000 with pre-existing conditions couldn't get coverage. That was one of, if not the primary reason that they pushed through Obamacare. Was it worth it? Now what's interesting is, even with this fact, do you think the liberal media will report this? This is on Goodman's blog. Well, it was reported at least once in the Washington Compost, but was it picked up by ABC, NBC, CBS News, ABC Radio? I haven't heard it, and I'm sure I won't. Is it a big issue in Congress? No, we have miscreants dressed up as Congress people, like Debbie Wasserman Schultz from Florida. Among the reasons she says that this repeal would be a disaster is all those people with pre-existing conditions who can't get coverage. Is there a single reporter who will confront her, armed with this information, and say, well, exactly how many of those people are there? No. Because the lib media in this country, while they're cheerleaders for this crowd, they're cheerleaders for their agenda, and I've written about it many times in Liberty and Tyranny the last time. What the media in this country are cheerleaders for the statists. I'll give you an example. When is the last time you saw a news program on the wonders of capitalism? On all the great inventions, products, advances that come out of capitalism, that save lives, that increase the quality of life, that improve lives, that create prosperity and jobs, that expand the availability of food, not just here but throughout the world. When is the last time the wonderment that is liberty was the subject of a program on television that wasn't on Fox by John Stossel or something? When's the last time? When's the first time? You'll never see it. It's always the horrors of liberty, the horrors of capitalism, and the wonders of government. Have you also noticed that the statists, Obama, Debbie Wasserman Schultz, and all the rest, they never actually want to manage what they've just created. They want to keep creating. They want to keep nationalizing. They want to keep expanding. They're done with health care. Now we got to move on to the next quote-unquote reform. What's that? The air. See, once they have health care by the throat, once they have our banks by the throat, our financial system, once they have our food by the throat, obviously metaphorically speaking, once they have our air by the throat, well, what's left? Let's see. Food, air, medicine, money. That's it. They've got us. Nothing left. And you got to get permission to live. Think about it. You know I'm right. Now, in a rational enterprise, you'd say, geez, we're spending $1 trillion out of 310 million people, 8,000 with pre-existing conditions couldn't get coverage. Well, let's get them coverage. Why do we have to destroy the entire healthcare system? Why do we have to make you and me eventually get different policies? Why do we have to punish doctors and hospitals and nurses? Why all this attack on insurance companies, which apparently seem to be doing a pretty damn good job if there's only 8,000? Let's be honest and stop all the evils and devils that they create. They shouldn't be our evils and devils. That's their problem. They always have to have an enemy. Notice government's the angel, and everything in the private sector is the devil. Have you noticed that? 8,000 people. That's it. 8,000 people, according to this report anyway, with pre-existing conditions who couldn't get coverage. Stunning, isn't it?